now we're going to go into specific exercise modifications. With neck disc issues, they are very, very used to this position. When you have people with neck pain, neck disc issues, they're probably going to have some form of forward head. And it might not be super noticeable, like the neck might look very, very straight back. However, if the chest is very lifted, this is not actually a straight neck. This is actually a very forward neck. So again, taking a look at the chest position, because the position of the rib cage is it's actually the position of the neck relative to the rib cage, not the position of the neck relative to gravity. Keep that in mind. Neck and rib cage is the important relationship, not neck and gravity, okay? So they're not going to be able to do a lot of supine exercises that involve curling up, which means most of Pilates is right out, which drives me as a Pilates teacher nuts, 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 nuts. So instead of doing curls, instead of doing roll-ups, instead of doing instead of doing single leg and all those wonderful exercises, you have two options. One, you throw them all out and you do everything prone, right? Instead of doing here, there are two things I can do. One, I can just put my head down. I'm still going to get some ab work. Two, I can take it prone. Some people are not going to be able to resist trying to pick up their head even with the neck down. So I'm going to do it prone. And I'm going to do here, 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 here. And this is where socks and a wood floor actually come in really handy. But you can get a fairly decent approximation of a lot of the exercises like that. It's a little hard to do, say, scissors with straight legs going up and down when in that position. And just keep doing those little mountain climber running things if you've got a group class and somebody just cannot hinge forward. Also, wall push-ups. Wall push-ups are definitely your friend. Now, again, this is coming from the when in doubt, modify range of motion, modify lever load, modify base of support. When we're talking about going from supine to prone, we're also talking about changing your relationship to gravity as well. So that's kind of a secret fourth addition to ways to modify exercises. So that's something else you can keep in mind. When you are doing wall push-ups, what you're actually doing is, again, you are changing the lever load. So instead of, I can still get some chest work without putting weight on my upper body. And sometimes that's going to be the best solution for you. So range of motion, lever load, base of support, but also relationship to gravity. And that's another thing when you have bands or you have springs in the Pilates equipment, so that then you have a way to change your relationship to gravity, which is super rare. All right, do what you can, have them do what they can, work with what you got.